Hey, my name is Mark Wilson. If you're looking at my mug, then you're probably doing the same thing that I was doing a little while back, looking for some information on ACDF surgery. I had a 4-level C3 through C7 performed on me here about 5 days ago. My situation was set forth. It was a workplace injury, and it was a traumatic injury. I'm a paramedic. Responded to a cardiac arrest. My partner and I showed up. We initiated patient care, rapidly got on top of the situation, and got the return of spontaneous circulation back on the patient. Which is good. Problem is that we were 30 minutes away from the hospital, so we had some urgency involved in getting the patient to the unit and onto the hospital. We had first responders on the scene. We had another squad respond to us, so we had plenty of help there. When we got the patient backboarded, loaded onto the stretcher with the cardiac monitor, backboard, ventilator, everything we had attached to the patient, we had about a 550 to a 600-pound workload. I know that may sound like a lot to some of you, but it's what we deal with every day. So we're well trained and have the proper equipment to manage that. Anyway, we moved the patient out of the house onto a back deck area, and we had a very steep but short set of steps we had to negotiate to get down to the ground level. The plan was to lower the stretcher all the way down to the deck. The stretcher was extended by 2 men out over the stairs. I was at the top of the stairs on the stretcher's extension handle. I was straighting arm it with my right arm, and as I picked the load up and extended out over the step, the plan was to lower the stretcher tires electrically down to the next step, which would allow and hold the load, which would allow me to step down, and we were to do that over and over again until we got down to the ground level. What happened is as I picked the load up, I extended it out over the step. The young man that was operating the controls raised the stretcher instead of lowering it, and he, for whatever reason, lost his grip on the stretcher, which flipped the stretcher to the side. What it did for me, it pulled me off center, of course added another 33% more load onto me, which I physically could not maintain, and it pulled me. This happened in a split second. It pulled me down. Halfway down, of course, my face came in close contact to the railing of the stairs, and I snatched my face to the side to avoid the railing. And I may have struck the railing. I don't even remember. It happened so fast. But I ended up looking at my hand still holding on to the railing or to the extension handle at the level of my feet. And I'm 6'4". I've never in my life been able to touch my toes. But so when I was sitting there looking at this and people were scrambling around me to correct the situation, I knew that I had messed up. So anyway, the situation was quickly squared away. There was no problem with the patient. The patient was securely fastened to the stretcher and to the backboard, so there was no problem with the patient. The other medic that responded to me, he took over patient care, and they took off with the patient to get him set up in the unit. I sat down on the stairs and to evaluate my injury, and I slowly moved my arm around to determine if I had any injury, and I was surprised that my arm worked. It worked in every position, behind my back, above my head. The only thing that I had that was any discomfort to me, I had a searing feeling between my spine and my right shoulder blade, my scapula. It felt like there was a hot coal there. It was distracting, but it wasn't debilitating. So I jumped up once I was assured that I wasn't terribly injured. I went on and continued my patient care and got the patient to the hospital. We worked 24-hour shifts, so the next morning I woke up and it was bad. couldn't hardly move my right arm. It felt like my right arm was broken. Felt like I had a broken humerus. There was searing pain from the base of my neck down across the back of my shoulder, particularly around the deltoid and elbow. I presented with numbness and tingling in my thumb and these two forefingers, and I had a strip of loss of sensation up my top of my forearm, and that unnerved me. Of course, I was taking some goody powders, which if you don't know what goody powders are, it's powdered aspirin and powdered Tylenol with caffeine. If you can get them choked down, they're pretty good stuff to take. In any case, that unnerved me, so I called my chiropractor, because several years back I had a lower back issue that I had tried to pick up a heavy log and toss it and pop my back out of place, and he fixed me right up, no problem. So I called him. It took me about a week to get in. He looked at my back and said that I had some torn muscles, a rhombus, trapezoid, and all that fun stuff. I had some issues. He tried some pressure point work on me. He did an adjustment to my neck and my back. Did some laser work to break up some of the muscle tissue to get it to release, and gave me another appointment following next week. Next week I came back. I was hurting worse. He did some more adjustment, put me on a TENS unit, a transdermal electrical stimulator, which did seem to help a bit, and scheduled me for another appointment. And between that and trying to cover myself at work, having other people do the heavy lifting and everything, I just couldn't work anymore. And I'd already spoken to my director, and she was aware of it. And at the point I started missing work, she said, "Hey, we need to stop right here and go in another direction." So they set me up got me into the Bone and Joint Institute, and the physician there said immediately after she examined me that I had classic symptoms of issues with my discs. So she set me up a MRI, came in, had the MRI done the following week. The following week after that, they called me back in for the review, and when the doctor came into the room, first question out of her mouth was, have you lost bladder control? Have you had any difficulty walking? Have you had numbness or tingling in your extremities? So all this was making me nervous. And when I tried to question her about it, she was very vague as to what the MRI read. And she said, "I want to send you to a urologist and have him speak to you and look at your case and have him, make sure we're going in the right direction." So a week or two later, I ended up at the neurologist. He came in and started talking about options, conservative options, doing nothing, and he went on to another conservative option, and I stopped him and I said, "Hey," I said, "what did my MRI see?" And he said, "You haven't seen your MRI?" And I said, "No, sir, I haven't seen it." He said, "Well, come here, big man, let me show you something." So he took me and put it up on the big screen, and I'm not a physician, but I could see that it was bad. The posterior facet of my C5, C6 had completely blown out into the area where the area to which my spinal cord normally sat, and he had just crushed it up against the back wall, and it was just pinching it off pretty bad. There was injuries above and below that also, but the doc pretty much said that we can do all the conservative treatment you want to, but that's not going away without intervention. So the option was, there was surgery had to be done. There was no way to get around this. So once the surgery was approved, they got me in, and I was nervous because I'd been watching all the the YouTube videos on the actual surgery itself. This was going to be a 4-level, which did not, make me feel any better. And I had a lot of anxiety with it. And I watched a lot of people and got a lot of opinions. And Some people had a lot of complaints with it. Some people said it was great. I showed up at the Optum Healthcare Center. This is a group of surgeons that have a surgical center in Reedsville, Georgia. They did an outstanding job on me. The worst thing of the whole ordeal from the time I showed up was getting a 20 gauge IV put in my hand. And when I say that was the worst of the ordeal, it wasn't because they did a bad job of it. That was just the most painful thing that I suffered. It was just getting an IV stuck in. The neurologist came in, spoke to me during prep, went over exactly what we were going to get agreed to. He got my final signature on it. He turned to the doctor, the anesthesiologist, and he gave me some Versed. And I kid you not, I woke up in recovery, did not remember anything as to what the surgery did. Is what it did. This is my scar. It's not very pretty. Stitched from the inside. It's glued at the actual incision point, and then it has a dermabond cover over it. And this is where I had it done Wednesday. The day is Monday, so no pain from this. I woke up in recovery. My throat was sore. First thing I did, moved my feet to make sure that my feet still worked, which I was very happy to see that. Then I reached up and touched my fingers, and I immediately knew that the sensation of returning my fingers, my hand was warm, my grip was strong. Every bit of the pain that I had experienced for 3 months that was relentless and never went away was gone. So I was ecstatic. I was loving life again. They took me to my room. I was back in my room by 11. They brought me lunch. It was just a turkey sandwich, soup, cookie, salad, sweet tea. And I looked at it like, there's no way I'm going to be able to eat this. And because I was swallowing, and it felt like strep throat is what it feels like. And it was only on one side. But once I started eating, got the first couple of bites down, I ate everything on the plate and had no further problems swallowing. I was able to get everything down, nothing backed up or anything like that. It was just getting that first couple of swallows down and, getting past the pain. The pain lessened every time I swallowed and ate. So eating improved the sore throat problem. They stayed on my pain management through the rest of the evening. They released me the next morning. The only shocking thing that I had was right after I ate my lunch, the physical therapy came in and said they were going to help me to walk. And I'm like, I don't have no problem walking. So anyway, they put a Hoyer device on me, which I thought was overkill. And they swung my legs off the bed and stood me up, and I was stunned that I could not walk. I felt like an infant trying to relearn to walk again. And the only thing I have no idea why it happened. The only thing I can tell you is that my spine cord was compressed for such a period of time that the signals became weaker and weaker, and my body compensated for it. And now that it was wide open and working again, it was like my legs were overreacting. I couldn't quite tell where to put my feet at. And anyway, they walked me all over the hospital, got me climbing stairs, and eventually released me the next day. So went home, followed they'll give you a stack of papers, and they'll give you pain meds to manage the pain in the area. My neck is stiff. I don't have any problem turning my head. I had an issue along with the other things they corrected was the natural curvature of my neck. They put back in because my neck was too straight, and that's why I'm not wearing a neck brace. The neurologist said it's a crutch. So he wanted my muscles to relearn to hold my neck up properly. So and that's the only true thing is quick movements in your head. It really, your muscles overreact, and I'm a little apprehensive about not have quick movements. But the pain level is absolutely manageable. If you do exactly what they tell you to do, you will not have any problems with this. Now, would I advise this? If you're in the same condition that I am, if your conservative methods have not done anything for you, do not fear doing this. It's like candy to me. I'm telling you, I can't emphasize enough how pleased I am that I had this done. Of course, I know my situation is different from a lot of people, but again, it's the same. If you have bulging disc or something and it's not responding to the conservative methods that they'll suggest, do not fear doing this. You will not regret it. And the Optum healthcare people, and it's totally unsolicited, they did a great job for me. And if you're in the Georgia region, advise you to at least check into them and see if they can help you out. So that's all I have to say. Thanks for your time and effort and listening to what I had, my input. I hope it helps you a little bit in what you've got to deal with.